I'm joined today by Dr. Parminder Raina, who is the founding scientific director of the McMaster Institute for Research on Aging and the lead investigator for the Canadian Longitudinal Study on Aging. What are some of the biggest challenges in studying aging?
I think that one of the biggest challenges in studying aging is ageism itself. Ageism plays a huge role, and we saw that during the pandemic. It was all over the place in a way how ageism policies actually resulted in so much harm to older people, especially living in the long-term care sector. So ageism is a major issue in relation to providing proper care, studying older people, coming up with policies that impact older people in a beneficial way. And ageism is not a one-way issue. It actually, older people are ageist towards other older people. And so it's a very complex issue which affects how we study older and how our results and our findings impact the policy, and clinical care actually is hindered by ageism. As part of our McMaster Institute for Research on Aging, many of our projects integrate older people and their families into our thinking. So they are actually helping us design research that is relevant to them. Our research is also looking at intergenerational relationships, how younger people relate with older people and vice versa. And I think if we are going to move research into practice, having those intergenerational relationships and them understanding what aging actually means. We don't age when we turn 65, we age the day we are born. And understanding from a developmental point of view actually will help us in the future how we tackle ageism.
One of the other issues, Parminder, that I struggle with a little bit is the absence of older populations in the large clinical trials that are done to approve medications, for example, the pivotal clinical trials. Usually the entry criteria end at age 65 or 70, which leaves a huge gap in our understanding of how drugs work in older people.
And you're absolutely right. I was just having conversations a couple of days ago that how older people are not included in clinical trials. And it is actually true on the pediatric side as well, because the conditions are so rare. So we don't really do many trials in younger populations either. And I think one of the challenges where science has to play a role is that we have to start thinking about what it means to be healthy older individual, right? In fact, by the time you hit age 68, on average, people have 3 to 4 chronic conditions, but they function, they live quite healthy. So our definition of what is healthy has to change, and that might help us improve what inclusion criteria we use to bring people into a clinical trial. And then the other area is the geroscience. Now, geroscience has put a lens on the aging process, and many of the future pharmaceutical targets that are coming, they are actually focusing on aging process, and they are not going to exclude people with multiple chronic conditions. So I think field is moving forward in that direction, but it is a big gap.
Dr. Raina, can you explain what geroscience is and how studying aging from different angles can help us live healthier lives as we get older?
Over the years, many of the researchers, especially in the basic science arena, have studied aging process, but they have generally focused on disease by disease ways of understanding the underlying mechanism. And basically, they have thought about how diseases contribute to the aging process. More recently, that thinking has changed because age is one of the major risk factors of diseases, and now the research community has labeled this new field as geroscience. That is saying how aging process, the biomolecular mechanisms or social mechanisms actually result in poor health and outcomes. So it is looking at this whole phenomena of aging research from an aging lens rather than from a disease lens. That's what the field of geroscience is.
Thank you, Dr. Raina. Your research on aging through the lifespan is vital for expanding our understanding as well as enhancing health outcomes. I really appreciate your time today. Thank you.
Thank you for asking me these questions.